Nigeria has recorded the highest number of cases of coronavirus in almost 6 months, amidst fears of a new wave of infections in the country. Now, the Nigeria Center for Disease Control, the NCDC, confirmed that 675 new cases are reported from various parts of the country in one day. The figure, which is 201 cases more than the tally reported the previous day, is the highest since the nation reported 684 single-day infections in June the 26th. Now, according to the NCDC, the federal government agency saddled with the responsibility of preventing and controlling disease outbreaks, Thursday's infections were reported from 15 states and the Federal Capital Territory. Of the new cases, the highest number of infections was recorded in the nation's capital with 183 new cases, followed by Lagos and Kaduna State, which have 128 and 85 more infections, respectively. Others are Kwara with 57, Katsina with 50, Plateau State with 42, Rivers with 39, Kano with 33, Ondo State has 21, Ogun has 17, Bauchi with 10, Sokoto with 5, Edo with 2, Ekiti with 1, Bayelsa with 1 as well, and Delta with 1. It's prime time in Lagos. State of the Nation starts now. You're welcome to the show. I'm Olumide Macaulay. Thank you so much for joining us. The Presidential Task Force on COVID-19 says Nigeria may be on the verge of a second wave of the pandemic, with surging cases across states in the last few weeks. Now, the PTF chairman and secretary to the government of the Federation, Mr. Boss Mustafa, explains that there is a rise in the number of cases in 23 states, as 4 states, Lagos, Rivers, Ogun, and the FCT, now have the highest case counts. The PTF also plans to make an initial purchase of 20 million doses of the COVID-19 vaccine in 2021.
As the countdown begins to mark the end of the weekly briefings by the Presidential Task Force on COVID-19, Nigerians may have to begin counting down the days until the possibility of a second wave of the COVID-19 pandemic.
We may well be at the verge of that second wave of this pandemic. In the past 24 hours, we have had 474 confirmed cases and 2 fatalities, with an indication that this week's figures will be higher than last week's.
In a summary, the PTF chairman, Boss Mustafa, notes that there was an uptick in 23 states. 12 states, including Sokoto, Osun, Edo, Nasarawa, Kwara, Delta, among others, had a 100% increase. By implication, Kaduna, Lagos, and the FCT have recorded alarming levels of case count.
States that have not reported a case in at least 1 week are Abia, Adamawa, Ebonyi, Cross River, Ondo, Niger, and Yobe. One assurance we wish to give is that any vaccine that will be approved for Nigeria will be endorsed by the World Health Organization and must be certified safe for Nigerians to use by our research and scientific bodies.
The PTF is also looking to advance a compelling case for the procurement of COVID-19 vaccines within the budget as it plans to roll out 20 million doses in 2021.
It's good to set aside, to speak with the National Assembly to set aside a certain amount. Not that we know exactly what it's going to cost, but to have something to start with when the need comes. I want to start with at least 20 million doses, which we are expecting from the COVAX facility to cover the mostly those who are, beginning with those who are working in the health sector.
As the task force further raised deep concerns over the flouting of COVID-19 protocols by religious organizations, describing their activities as a sabotage, they have promised to significantly scale up enforcement. In 2 weeks, the PTF is looking to submit its final report to the president. Gloria Umezuke, Channels Television News.
Now, our guest is Dr. Modupe Akinka of LASUCOM. She's also a consultant public health physician to talk to us about this issue. You're welcome to the program.
Thank you very much.
If this recent increase in the number of cases across the country is indicative of an impending second wave, God forbid, could I begin by asking you what is your initial assessment of how the pandemic has been handled thus far in this country?
Well, in the handling of the pandemic, at least Nigeria has done relatively well, I would say, because at least we were able to try and flatten our curve, at that point. But of course, we need to do better because there is a need to engage the community a lot, because many people are just going up and about, and they're not protecting themselves anymore. And when you're wearing a mask, now you look like the odd one out. When you're washing your hands, you're looking like the odd one out, So Nigerians seem to have gone back, to the old ways. And if we do that, then definitely with what we're seeing now, we're looking at having a rise and possibly a second wave. So we need to get back to doing those things that we know to be, public health measures against COVID-19. And so that, of course, will ensure that we scale up on our response to it as well, because the response initially and some sort of enforcement at least was in place. You couldn't enter some places without the mask or without washing your hands. But after a while, the enforcement was nowhere to be found at all, and everybody was doing what they liked. And so we need to get back to more of that enforcement of those public health measures, those simple public health measures that we can use to prevent this disease.
One of the reasons I want to ask you if you think one of the reasons why people are not adhering to the COVID-19 protocols, which was a precursor to the relaxing of the lockdowns, which is why businesses and schools have been opened and business around the country has got back to its feet, as it were. How do you think that the country can move forward if they think that there's no COVID-19, for those that think that that is the case?
Well, we're going to have to move forward. We're going to have to move forward. So we need to engage, government needs to engage with, the communities, different people within the communities, the gatekeepers, those people that have influence over people, so that at least they can, tell them about it. For example, the people that go to church, telling them about it and ensuring that those protocols are followed. People that go to mosques doing the same thing as well, and then ensuring that the protocols are followed. And then, of course, we do not pray for another lockdown, because Nigeria is already in a recession based on the economics that have come up. So we don't want that. So people need to ensure that when they are carrying out their activities, they're actually conscious of the fact that they need to protect themselves and they need to protect other people as well. So adhering to those measures would help us actually to prevent going back to the days when, movement is then restricted. We don't want that at all, because that will definitely be counterproductive. But with what we have on ground now, what each person then needs to do is to take responsibility. NCDC has said, if you don't have to travel, don't travel. Stay at home, go to work, but protect yourself. Use your face mask, wash your hands, avoid crowded places, right? So just taking all of these measures would help us and hopefully drive down the number of cases. And of course, avoiding gatherings, large gatherings, this is still not the time to go and start having parties. I know we have missed the parties, but there's still COVID-19. And so we need to ensure that we don't get back to where we're coming from, which is having so many cases and then having to lose people or lose lives, loved ones, and that we don't want that again. So let each person take responsibility and then each person engage the other person as well when you find them doing things that may put you at risk or put other people at risk as well.
Compared to other countries around the world, and given predictions that Nigeria, that Africa will, have the short end of the stick, there'll be a lot of people that will die concerning COVID-19. That has not been the case in the most part. Why do you think that has occurred? That it's not as bad as in America and in other countries in Europe?
Well, we're very grateful that it didn't turn out to be like that. And I believe God has been very merciful to us. And apart from that, when you look at the things, the factors around here, you may want to say that maybe some of those factors have been in our favor because our people already face, a huge number of infectious diseases already. So we have at least the younger population have a lot of immunity because they've been through lots of infections. And then apart from that, our population is actually younger than the population in these other countries. So, and then we find that with COVID, the response from younger people generally is better as opposed to the elderly. And then we don't have, we also have some elderly, but our elderly are not really clustered, the way they would be in Europe and America. We don't have that large number of old people's homes, right? So, and all of those centers that would care for the elderly. The elderly are there in the homes of different people or in their own homes, right? And then some are in a good number are in the rural areas as well. So all of these factors adding up and then, coming together have somehow been able to help us, and thankfully too, been able to help us so that we were not as affected as these other countries. But that is not to say that we should take it for granted. We should ensure that we're taking all of the precautions so that, the second wave that we have seen and is still happening in those other countries does not become something that happens here. We don't want that. So we need to take action. And you may say it's even getting rather late because now we had 675 new cases, which is an all-time high compared to what we had been having before, between June and now. So we really need to get our act together now so that we don't get into so much trouble with COVID-19 that we have so many people dying needlessly. We don't want that at all.
We certainly don't want that. We'll take a break now on State of the Nation and be right back. Stay with us. You're watching State of the Nation, and our discourse today is on the COVID-19 pandemic and the recent publications from the Presidential Task Force on COVID-19 and an increase in the number of cases. I have with me Dr. Modukwe Akinka of LASUCOM. She's still with us, and thank you for staying on the program.
Thank you.
Now, we know that the vaccine has been developed, and do you think that Nigeria will put herself in a place where we can have access to the vaccines in a timely manner?
Well, I believe Nigeria will, because at least we are making plans, even though you would say that it's been, the vaccines already, and all we are doing is to do that. But when you look at the burden that they have, of course, you would know that it becomes, a great priority for them to get these vaccines, right, compared to our own burden. But that is not to say that we shouldn't have prepared. And it's good to know that we're making plans to actually purchase those vaccines so that those people that are most vulnerable to this disease can get the vaccine once they are willing to take it. And it would prevent them, hopefully, from getting the infection. And that would help our cause as well.
Yeah, the PTF said that they've planned to make an initial purchase of 20 million doses of the COVID-19 vaccine in 2021.
Yes, in 2021. People already have bought the vaccines now, but at least it's a plan that's in place. So hopefully the plan will go through. But before we even get the vaccine, we need to do more concerning the actions on people, so that even before the vaccine gets to us here in Nigeria, then we're already taking those measures that help to prevent COVID-19 from spreading.
As a public health physician, you meet a lot of people and you know what's going on as far as what people are thinking about the virus. For those that think there's no reason for the lockdown, for the protocols to be observed, social distancing, wearing of face masks, what would you tell them? And what can the PTF do to begin to ensure that these protocols are observed?
Well, I would tell them that if they haven't seen COVID-19 cases, we have, right? And we know people that have had this disease. So it is really real, and it is something that can be prevented. Simple public health measures. Avoid all those crowded places. Wear a face mask and protect other people as well as yourself. Wash regularly with soap and water, frequently. And don't make contact with, direct contact like that with people. You can greet them from afar. We already know all of these things by heart. So most people do. So what we need to do is to actually ensure that we are adhering to these measures, even if not for ourselves, but for the members of our families. Because if anybody contracts COVID, the person will most likely take it home. And in their houses or in their homes, they will have people that would be more vulnerable than they are, because they are the ones that are going out. They may have the elderly, they may have people with comorbidities, they may have children, right? So to protect all of these people, then we need to protect ourselves. We need to take responsibility and protect ourselves. And of course, the PTF needs to get the message across, and then getting people also to enforce in different places. For example, the offices, places that are more at risk, or people are prone to getting the disease. If one person comes in there and then has COVID-19 and then can spread it, even clinics, clinics should not be crowded. This is, we need to ensure that we adhere to these measures so that we are able to protect ourselves and protect our people.
Speaking of which, protecting ourselves and protecting our people, you mentioned earlier about our immune system because of probably also our temperate climate. Can you speak more to that point where building your immune system is a good thing?
Okay, well, building your immune system is definitely a good thing, not just for COVID, but for other diseases as well. So people need to ensure that they're taking good nutrition, eating good food with the different nutrients in the food, ensure particularly things like proteins, carbohydrates, different types of food. So a diverse diet, containing also vitamins and minerals, and then things like fruits and vegetables, carrots, particularly those that are in season. So taking all of this, having that diverse diet and drinking lots of water as well. And of course, getting adequate rest. So all of this would then help us to build our immunity so that we are resistant, so that even if we do come across it, then the chances of us overcoming the disease would be really high, or much better than if we were not getting adequate nutrition. So definitely that is something that everybody should be doing at this time, but not just at this time, but on a permanent basis, so that we're ensuring that we're taking good care of ourselves and of our families as well. Regardless of your income, you can actually take good care of yourself and get adequate nutrition, with different varieties of food. It doesn't have to be the most expensive food before you can do this. So people need to get this message out there. And of course, the ones that the babies and the children as well need adequate nutrition, so that their own immunity is also quite good, so that they can resist whatever infections come their way, including COVID-19.
Finally, you mentioned about enforcing the COVID-19 protocols, possibly from the Presidential Task Force on COVID-19. How far along do you think this will help us in making sure everyone is involved in keeping these protocols?
Oh, it definitely will help the protocols to be adhered to, because human beings are the same everywhere. If there are no consequences for doing the wrong thing, people just go ahead and do it because there are no consequences. So if there are consequences, for example, if you have to sanction companies and things like that, for allowing people to come in without using a face mask, or if they are not adhering to those protocols, if sanctions are meted out, then these people would ensure that the customers that patronize them would adhere to these protocols. And of course, if you would not adhere, then they wouldn't want you to be a customer, because you're going to cause a lot of trouble for them. And the trouble you're going to cause for them will be more than the money you're going to pay for whatever services you're receiving from them. So definitely enforcement, because it's like driving properly, getting a driver's license. It's all, if you don't enforce it, then people won't want to do it. That's just human nature. So enforcement is definitely going to help. But of course, engagement is also very important, because people have to know that these things are for their own protection. So we still need to definitely engage people, give health education, and raise awareness and let them know that it's all for their benefits, based on the facts and figures that we have on ground. And so it makes it easier for people to adhere. And then, of course, by the time they know that there will be consequences if you do not, then we are getting closer to getting better adherence to the protocols.
We certainly hope that these figures that have increased begin to decrease. Thank you so much for your expertise on this issue.
Thank you very much for having me on the program.
We're speaking with Dr. Modupe Akinyinka of LASICOM, a consultant public health physician, on the State of the Nation today, as the increase of COVID-19 has affected the states across the country. Thank you so much for watching. I'm Olumide Mukol.